Hello, everyone. Before we get started, let's be sure everyone is able to select their language channel. The options available for this session are English, Spanish, or original audio, if you would like to hear the audio without interpretation. For people connecting through a computer, you can choose your language channel by clicking on the interpretation icon to the bottom left that looks like a globe. For people connecting with a mobile device, you can choose your language channel by selecting the More option, then Interpretation, then selecting your language from the available options. We extend much gratitude to our interpreters today. We also have live captioning available that can be accessed by clicking on the multimedia viewer box on the right of your screen. I would like to now welcome you to today's webinar session, Conversations with Elders, Elder Abuse and Domestic Violence. This is the last webinar for our accessible, culturally responsive, trauma-informed lifespan webinar series, and we are so excited that you're able to join us. My name is Tori Weinkoop. I'm from the Spokane tribe, and I use she, her pronouns. I am also the Training and Technical Assistance Manager with the National Center on Domestic Violence, Trauma, and Mental Health, and your moderator for today's session. Before we introduce our panelists, I would like to quickly go over some troubleshooting tips about this platform. If you get disconnected from today's session at any point, please re-enter the session using the original webinar link that was emailed to you. If the sound is unclear, it is likely due to an unstable internet connection. If this happens to you, feel free to call in for a better audio connection. If you are experiencing technical difficulties, you can directly chat with Carla Alegria, also with the Center for Assistance. If you're unable to contact Carla, please reach out to WebEx Tech Support. Carla will post that phone number in the chat box. We welcome you to use the chat feature to share thoughts, questions, and resources throughout the session. Your screen may look a little different depending on what kind of device you are using. Usually, the chat box can be found at the bottom right of the screen. You may have to click on the chat icon that looks like a speech bubble to open it. Let's test the chat feature now. So please introduce yourself in the chat and let us know where you are joining us from today. And while you are doing that, I would like to also note that our center is headquartered in Chicago on the unceded homelands of the Council of Three Fires, the Odawa, Ojibwe, and Potawatomi nations. We invite each person to learn about the land you are connected to. One resource to get started is the website native-land.ca. And thank you all for putting yourselves in the chat. I see a lot of people from all over across the country. This is great. So thank you, everyone. I will now like to hand it over to Victoria Ferguson-Young to introduce herself.
Hello, everyone. My name is Victoria Ferguson-Young. I am the Victim Services Coordinator for the National Clearinghouse on Abuse in Later Life, also known as NCAL. I currently live in Atlanta, Georgia, but NCAL is located and based out of Madison, Wisconsin.
Thanks, Victoria, and I will pass it over to Gregory.
Hello, my name is Gregory Potts. I am the supervisor for the older adults team at the Community Counseling Centers of Chicago. As the name suggests, I'm coming to you from Chicago. Issues related to elder abuse do come up pretty often in my work. It's not the exclusive focus of my work, however.
Thanks, Gregory. And over to Amanda.
Morning. My name is Amanda Lyon. I am a training and technical assistant specialist. I work for the National Center with Tori, and I am calling in from Alaska today. And my piece for sharing is some of what I've learned from interacting with our Alaska Native elders and the culture and what they've experienced. So I'm really excited to be here today and to share with everyone and hopefully all learn from each other.
Yes, thank you all so much for joining me today on this panel. I would also like to note that I am actually currently in Shawnee, Oklahoma, turning in for today's session. So I am so excited to hear more about your experiences and what you have learned working with elders and individuals who have experienced abuse later in life. The purpose of today's webinar is to highlight the impacts of elder abuse and include these conversations within the domestic violence field and movement. This is part of doing the accessible, culturally responsive, trauma-informed work and framework by including elders, their families, and service providers by uplifting and supporting the knowledge and leadership around this topic. So I want to start off by asking the first question of today. And Victoria, I'm going to start off by asking you, why is cultural responsiveness needed to support survivors experiencing abuse later in life? What can this look like?
Thank you so much for the question. The first thing I would say is that it's so important because there are so many older adults who are simply being left out, who really are alienated, who are isolated, in particular due to their identity. And so it's absolutely critical that as service providers, we are really being intentional about connecting with older adults who aren't of the status quo, those who are from the most marginalized and vulnerable communities, that we are really taking the steps to eliminate as many barriers as possible, to make them feel welcome, to address accessibility for differences. In particular, culturally, it's important that staffs from service provider agencies are reflecting the community. It's important that that service organizations are partnering and working with organizations that specifically work with certain cultures or communities. So culturally specific organizations are that they're normally called. These days, I would say if organizations aren't partnering with a culturally specific organization, they're really missing the market. There's not a partnership, an intentional partnership with the community outside of your own. You're really missing people. And so oftentimes in my role, I didn't say when I first introduced myself, but I do oversee and work with grantees throughout the country who all have been awarded an abuse in later life grant. And so I'm always encouraging them to make sure that they are thinking of and reaching out to the most marginalized and vulnerable communities. Additionally, we also just want to make sure that there's intentional outreach there, and that there's even staff and advocates are even looking into training as to how to better connect and how to improve their cultural responsiveness. So it's an intentional action. It's about relationship building with these various communities and communities of color, with these most vulnerable or marginalized communities, immigrant communities, that, it starts with building relationship. It starts with being interested in what's going on in these communities. Looking to see, as an agency, can we attend any events that, a community of color is having, or, how can we support these communities? How can we learn more about, what's going on in communities that speak different languages or that are immigrant communities or communities of color? So being intentional again about relationship building, partnership building, to be able to provide, just improve your service provision is so important, because no one can do it on their own. We all don't know everything, and we can't know every single community or difference or be completely familiar with every identity. But what we can do is seek to connect with those who are really doing that work, so that our service provision can improve and we can learn what we can do better.
Yeah, I really just want to, like, you just really sparked something in me when when you were talking about the intentionality around relationship building, especially within communities of color, or immigrant communities. And for myself, I do remember when I worked as a domestic violence advocate on my reservation, when I was working with elders who were experiencing domestic violence. It wasn't, it was important very much to make those other program collaborations. Another part of that cultural responsiveness that I started to realize was recognizing the generational cultural differences as well. And like, the younger generation's connections to technology, whereas, these older generations, um, especially in an isolated area that I came from, didn't really have much access to the internet, or, just chose not to, which was perfectly normal from where I come from. And so, really being intentional about attending these events to make those connections with the elders, and with the other staff program individuals to ensure that, we're really trying to build this collaboration and this capacity to ensure that we are serving everyone who may need this support at some point. So, yes, I completely agree that the intentionality is very important, especially when it comes to working within our own communities, or maybe a community that you're just working within, understanding those cultural dynamics and how they may come up within domestic violence, power and control dynamics themselves.
Correct. I mean, I might just say one other thing. Advocate, when I was doing direct service work many years ago, I remember working with many immigrants from various different countries and those who had protective orders issued against them, who never knew that, domestic violence was a crime,
Mm,
in their country
mm,
where they were native to. It wasn't criminal to do what they had done. And so it was really just eye-opening. Like, I had no idea this was like a normal thing. So again, just another example I thought of how important it is to really seek to learn as much as you can about those in your community, and to recognize also that just because you may not be seeing a certain demographic or group of people doesn't mean that they're not there. Oftentimes there's thoughts of, well, we really don't have anyone from the LGBTQ community who are coming for our services, so we just don't really address that. Well, it's not because they're not there, but it's really because it's not being discussed, or it's not known that they're welcome to come, or that they would get safe and secure services if they reach out.
mm,
What messages are being sent that it's okay for me to call, especially if you are part of a community that's been stigmatized or that is especially vulnerable. So again, important to just really think about those things and look around and think of, as service providers, when you see your clientele and those that you're working with, is everyone kind of the same? Like, who are we not reaching? Who's not at the table here? Who do we still need to reach out to, and who do we need to contact, and who do we need to get our resources and information to? Because ultimately in this work of service provision, you want to see more people come forward, right? We ultimately want to stop this issue from happening, but in the meantime, we want more people to come forward. We want to get
mm,
more calls and know that we're reaching and able to serve and provide service and assistance to more older adult victims, because it's so especially underreported. I think the statistics are 1 in 24 elder abuse cases actually get reported. So it's definitely happening, but more often than not, older adults aren't coming forward asking for help, and they're not reporting the violence that they're experiencing.
mhm. Can,
Yeah,
can I add something to that too?
of
Uh,
course.
There's another part of what I heard Victoria saying, which was about isolation. And we know that people who are experiencing abuse are often isolated by that experience of abuse. It's also true that older adults are often socially isolated for other reasons, like if someone's experiencing a disability that makes it difficult for them to leave the house, or maybe a lot of the key people in a person's social network have already died. And so when you compound the isolation that's associated with abuse with some of the isolation that's common among older adults, yeah, it can be really hard for someone to come forward. And in fact, um, you know, someone may be really reluctant to report their abuser because that abuser may also be one of the only support people around. You know, I mean, I use the word support, you know, carefully, but um, even if a relationship is toxic, a person may want to hold on to it because they don't have a lot of other people around them, you know?
Mhm. Yeah, that is a very good point in terms of how isolation becomes prevalent throughout our older years,
Mhm.
unfortunately.
Yeah.
But that is actually a really good segue into our next question of how can human service organizations and programs actively support the voices of elders who have experienced abuse?
I would love to speak to that. That's okay.
Yeah, go ahead, Amanda.
So, um, something that I saw here in Alaska that I found really powerful was our our state coalition was trying to take their advocate trainings directly into rural communities. And in Alaska, if you don't know, there are many communities that are not on the road system. They can be extremely isolated. So there are communities you have to either fly into or take a boat into. They can have very limited services and be hours away from law enforcement even. So in taking the advocacy trainings to the villages, they were able to have multi-generational attendance. And I thought it was really powerful to be at one of these trainings and have some elders in attendance who they held respected positions in their community. But as part of the process of being with younger generations and receiving this training, they were able to talk about how their generation experienced so much abuse starting in childhood. Um, and I know that's been well documented in Alaska, especially with the boarding schools, where in some villages it's an entire generation of children that experience sexual abuse. And we know that then sets up the cycles of abuse in families. And so these elders, they spoke about how when they experienced abuse as children, not only were they silenced, but also received further abuse whenever they spoke up. And it just started cycles of violence for them throughout their lives. And coming to a training, they were feeling really empowered and wanted to be able to help the younger generations because they didn't have any support themselves. So I think actually reaching out to elders and empowering them, knowing that in many communities they are respected, that they can be leaders, and they really oftentimes enjoy supporting youth and younger generations, I think can be really, really powerful. And I don't think we always think to, include elder generations, in our advocacy efforts to empower them to actually be part of those efforts.
Yeah, I've definitely noticed that for myself working within Indian country that elders traditionally are viewed as the individuals that hold a lot of knowledge. But unfortunately, due to colonization and the impacts of boarding schools, those teachings have been lost and are being currently revitalized. So it is really important to understand that when we are doing these advocacy reach outs, that, you know, just because the elders or our grandparents aren't saying anything doesn't mean they don't understand what we are trying to advocate for. And so it's really important to open up that space for everyone, as Amanda mentioned, how in Alaska they opened it to be multi-generational. And I think in that self, that's really healing because we're able to see where the root of these oppressive systems are beginning and how we can heal and move past all of these, abusive practices and tactics that have been put on, not just on Indigenous communities, but across all communities of color or historically marginalized communities across the United States. Gregory or Victoria, do you have any thoughts around this question at all?
I'm not sure, actually.
That's fair. That's fair. Well, if you would like, we could actually transition into our next question, where I would like to ask you, Gregory, what does it mean for human service organizations to be accessible for, did I already ask this question? To be accessible for elderly impacted by abuse?
It's a slightly different question than the one you just asked.
Yes.
Um, um, my thought about this is that it starts with training staff. And I don't mean to pick on my employer because I think that what happens here is pretty common. But where I work, every single clinician in the organization is required to do an online training annually about child abuse and about our responsibility as mandated reporters. And we have like zero training. I mean, at least zero agency-wide all staff trainings for elder abuse or adult abuse in general. And so I think that's a really good place to start. And it's in some ways a lot more complicated than child abuse, right? Because
Sorry, you cut out there for a second, Gregory.
here I am.
Okay.
Here I am. Can everyone see me and hear me? Good. Okay. Sorry about that. No, I was just saying, with child abuse, it's like anytime you suspect abuse and the person's under 18, then we're considered mandated reporters. With older adults, it's much more complicated because we're only, I mean, it may be different in different states, but at least in Illinois, we're only mandated reporters if we think the person is unable to make the report themselves. If someone's physically unable or cognitively or psychologically unable to make the report themselves, then we're mandated reporters. But that's a much more gray area, determining who's able to make a report and who's not. I mean, and in fact, I think there could be times when making a report without the client's buy-in can become kind of like infantilizing. Oh, like, you know, you're older, and so I have to protect you. Well, yeah, maybe sometimes, but I think it's ideal if we can get buy-in from the client and work on that together. But like I said, I think the starting point is just like to make it part of our conversation, make it part of our culture, and make it part of our training. I don't know what you see in other organizations. I mean, I know most of you work in the domestic violence field, so it's different. But here I'm just working in a general mental health setting where it's, abuse is one of the issues we deal with. And so I think sometimes it can sort of like fall under the radar.
just wanted to speak a little bit more about that. When I hear the question, I just think of how important it is for agencies to look at and kind of do a self-assessment of like what things they're doing to improve accessibility, or like what areas do they need to work on, just really in a practical sense. And I'll come back to their word partnership again. To work with or consult with an agency that maybe is disability like focused, those who work with older adults, to talk with and partner and to say, like, what things do we need to do? We want to make sure that we are, as accessible as possible. Are there areas that we have blind spots? Are there areas that we're missing? I think oftentimes, you just kind of, it's just not really thought about, or, kind of the question is, when I worked at the shelter years ago, we just weren't, just things we just weren't accessible for. Like, we just don't offer that. We just don't have it. And it really wasn't like a conversation about, okay, how can we improve on that? It was like, that's just what it is. We're just not able to provide this service. But, now I think it's so important for agencies, and everyone may not be able to do everything, but to really examine, the areas of your agency and accessibility, and, from having ASL interpreters to, information translated to various languages, to, of course, like just mobility accessibility, just really looking and thinking of what areas and what things can we improve upon, and starting there. And, if there are things that you can't provide or that you're unable to do, know who can in your community, or where can, if we do need, or if we are providing, or, doing a crisis call for an older adult, if we can provide a service, it's important that you know who can, or to be able to tell them where they can, get the help that they need. Just trying to be as equipped as possible, and just knowing your resources. I think, as Gregory said, training is so important. And that's even, just having really great conversation among staff, and, talking about research, reviewing what resources you have. Where I work at NCall, we do that just about every couple of weeks. We've been going through all of our resources to see, what are we missing? Is this up to date? Is this accurate? What can we do a better job, so that when people are coming to us asking questions, we know what we have, we know what we don't have. So just kind of starting with that self-assessment is something that everyone can do to just even heighten your awareness as to where do we need help, how can we improve, on accessibility for older adults, and recognizing that there is such a difference, in providing service to older adults, than those who are younger. Some of the things, like Tori, you mentioned, even this technology differences, and then if there are older adults who maybe do or do not have children. I mean, just there's very different dynamics to think about. And obviously, if there's health issues or mobility challenges, there's many different things to consider, to be able to provide the best service. But it's so important that service providers, we are thinking about, how can we improve upon this, versus, just that's all we can do, like really thinking, how can we do a better job? How can we improve our accessibility? How can we provide more service to more people? Because so many folks are hurting. So many are just in really difficult and challenging situations and want help, and really need it. So it's important for us to really think about, those things. And again, to partner, or even have a consultant for other agencies who maybe specialize in the area where you need help. Working in silos really only works to detriment, and sometimes it may be easier to do that. You work with people who you're comfortable with, but really getting outside of that comfort zone and connecting with other agencies and individuals who specialize in an area that you're not familiar with can make all the difference.
Mm-hmm.
Yeah, thinking about accessibility, especially for elders, and for older adults, is really challenging in its own ways. So when I was back home, this was before actually I started. One of the main reasons why they were able to identify that elder abuse calls, or like elder abuse reports were coming in, was because based on the information they had, a lot of it came from the older males within our community. Um, and then it seemed to follow a pattern of once like the elderly men started to call in, elderly women started to call in.
Mm.
And it came to a point where they saw that it was actually 1 in 4 reports that they were receiving in our organization was a call about elder abuse. And so they had recognized that, due to the funding that they were receiving, whether it was under OVW or under OVC, they needed to update their needs and extend it to individuals who were experiencing abuse later in life. And so when I began working there, they had just completed updating our law and order code because that went from a paragraph long of what elder abuse was defined to about 4 pages long to what it is now. So thankfully, they were able to update that information because one thing I was noticing was prior to these updates and, making adjustments for accessibility was that our traditional values and how we want to, treat and respect our elders was not being reflected within our organizational mission. And so during that time, the leadership had changed that to help reflect that message. And so they had gone through a lot of trainings around elder abuse. And so I would say that after they received the training and continued to receive the training, the next step was to do community education. And that's what was one of the main job duties for myself was going into the community and giving out information. And some of the conversations I had were really eye-opening. I used to do monthly newsletters and I created brochures on like what is domestic violence or what is teen dating violence. And one of them was elder abuse. And I remember one of the women in our community was like just so shocked and appalled to see that elders could be victims or survivors of sexual assault later in life. And her question was, who would want to do that to an elder? Like, who would want to do that to our people? And I remember having to describe to her that it wasn't so much about like, that sexual gratification. It was more about that power and control and being able to dominate the person, whether that was their own family member or a caretaker that was within their homes. And so, really having those hard conversations, I recognized within our community
Mm.
was
Mm.
needed.
Mm.
And it also did open up the door to, oh, wow, like maybe I am experiencing this. And then
Mm.
making those connections
Yep. Yep.
between
Yep.
that abuse and like the boarding schools and how it's just trickling down through the generations and just, it almost seemed like it was giving more answers to why we were still or why we still are experiencing the high levels of violence that we are in our communities. So I just thought I'd like to share that in terms of like accessibility. It's not just providing resources, it's also providing that information
Yep.
on what it is, because many times we may not even know that we're experiencing this, especially within our older populations. Like it's it's really good to provide that education and then receive that feedback because we need that feedback to understand like are we actually understanding what's happening or are we just going based off of the research and not listening to their own experiences. So um are there any more thoughts?
Tori, I was nodding vigorously while you were talking. Because the point I was making before was about educating staff, but educating the people in the community that we're working with is also, part of the work. And like you said, people often, are experiencing abuse, but that's not the word that they're attaching to the experience, because the abuse has become so normalized that that's not how they understand what's happening. And in fact, for some of our older adults, what we see as abuse may be something that's been going on for years. And so it's just part of the way things are that they accept. And so that's where education of ourselves as workers, but also education of the people that we're working with is essential. And someone made the point earlier about how like maybe certain immigrant groups might have different concepts about this because of a different cultural history. I think it also can be true for like in same-sex couples that maybe they just don't have the concept of that this can happen in a same-sex relationship. So yeah, I think that education is really critical and in short supply. Yeah.
I had one other thing I wanted to say real quick on this piece of surrounding outreach and making just to consider in your outreach materials and in doing community education that the service providers, you're also like describing what type of services you have and what to expect. What we've come to find from my work is that a lot of older adults, may see something. There may be a type of investigation or adult protective services could be involved. But what does that look like, and what does that mean? Are the police coming to my house? Is someone getting arrested? If I call this number, who am I going to talk to? Is it going to be a police officer? Will it be an advocate? What do they do? So really, in doing your outreach or even in your outreach materials, making sure that you're using just plain, simple language to really describe what to expect, what will happen, where will you, if you come in for a support group, where is that, what is that like? If you're doing outreach in the community or speaking at a senior center or wherever you may go to, or faith community, describing, those services is critical. And also describing behaviors. I think like Gregory was saying, I often talk with grantees in their outreach materials about, it's in addition to or listing types of abuse, but describing the behavior. So asking a question like, is someone using your money without your permission? Is someone hitting you or pushing you, but not labeling it or calling it abuse, because as he said, like everyone doesn't identify with that. So you really just may be able to connect with more older adults in the language that you're using and how you're describing things. So thinking about that a bit more, just a little bit more, and maybe taking that approach may, allow more older adults to come forward and realize, well, I'm not being abused, like I don't consider that abuse, but yeah, my son is using my money without asking me, or things like that. So having to really consider it and from that perspective, and just thinking, examining your outreach materials, and also, pictures that you have on them, and if you are having outreach materials for older adults, how you're showing, older adults, what are they doing in the pictures? As we know, all older adults aren't mobility challenged. We got 90-year-olds running marathons and really active. So showing just the spectrum of of livelihood and ability for older adults. And of course, we have those who do use a wheelchair, but who are still very active and independent, that may still drive themselves and things like that. So, just being intentional about that, as well. I just real quick remember at an agency I worked at, most of our materials had pictures of younger adults or younger women with young children, and older adult women often thought, I can't come to this shelter because I'm not a young woman or I don't have children, although that was not a requirement. So we decided to make a lot of changes to that once we got more of that feedback. So it's important to just look at and again kind of self-assess and examine, like our materials really communicating just communicating that who's welcome here, and also are they describing services and types of abuse that our potential clientele or older adults would recognize and would relate to.
I love that, thinking about materials, and it's like that being part of accessibility. And it's like all of this, I think, is so important. I think the one other aspect to think about is, how in our organizations, in services, are we actually truly honoring elders as well? It's like even beyond just, kind of, okay, well, they can come, do they really feel welcome? And especially thinking about it culturally, what can we do to show elders that they are respected and that they are honored? Again, like giving them ways to feel like they are empowered, like this actually connecting into services leads them to that place of having greater personal empowerment, having greater self-efficacy, having a greater voice, feeling more connected to their communities, rather than feeling that connecting them into services is going to lead to greater isolation or disconnect from their loved ones. So it's like, I think bringing in like this really holistic picture and doing that organizational assessment from so many perspectives, I think would be really powerful. So yeah, I love all these comments. Thank you.
Definitely, definitely. There are so many routes and avenues and ways that programs and organizations can become more accessible for older adults and elders. And with that in mind, we also want to ensure that we are including the voices of elders and older adults within the creating the foundation for the accessibility for these services, and creating these spaces and where they can feel safe to share or feel safe to just be within these service areas. And so with that in mind, I want to ask to all three of you is, what advice do you have for elders who want to get involved in leading efforts to combat elder abuse?
Um, I think starting off pretty simple would be, of course, what's your local organization? Do you have a DV organization that may be able to connect you into whatever your state requirements are for advocacy training? So for example, in Alaska, there's a 40-hour advocacy training that can be completed online at any time. So that can be a great starting place. And then trying to start as a volunteer, like how can I support outreach, and how can I support outreach in the organizations that I'm a part of? So, having somebody who's an elder might be a great person to support outreach to the local senior center, or maybe they can support outreach to their religious organization that they're a part of, or spiritual organization, or maybe they have a different cultural organization that they could then provide connections and outreach to. I also think it's really powerful when there are programs set up for elders to connect with youth. So I think there's also possible avenues for elders to, be part of even support groups or other programming for children. I'm trying to think of what all the different things that we have locally in our small community. There's outreach in schools. So I think for elders, there's a lot of potential avenues that they could get involved in their communities, depending on what's available. And then I think if there's not very much available locally, contacting their state coalition or statewide organization to see if maybe there are other online opportunities or places they could get involved, or other connections that way as well.
I love what you said, Amanda. I just to a little bit in addition to that, I would just share so the agencies are places where elders may frequent to, with leadership to share things they'd like to see, and to make make their support needs heard when they do reach out to really clearly just share like what needs they may have that aren't being met or what they want, advocates or leadership to know. I think that's a really great, really great question. For us to all think about. I wish I had even more to say about it, but like really echo what Amanda said. Starting with your organizations or agencies or things you're a part of, and sharing the needs that you'd like to see. So, and even to organize your own thing as well. Sometimes some of the best work normally comes when you're not seeing there's a need that needs to be met, and you do the work to meet it, if you can, of course. So I echo what you say, Amanda. And I think as service providers, we have to really be vigilant and intentional to create the spaces to listen. So I know there are more agencies that are having more support groups or gatherings for older adults, and to really be intentional about listening to those needs and and honoring them, because the voices of older adults often become silenced or kind of pushed to the margin. And that also speaks to, I think this the piece and how important it is to be real clear about ageism and how it shows up and how ingrained it is, and very, covert, and sometimes don't even recognize that it's there. There's so many jokes and all about it, but it really does erode just trust and honor with older adults. And so it's important that we're conscious of that, and that we're mindful of it, and that we actively seek to hear as well from older adults. So a lot of intentionality has to go into really seeking to serve these important, oftentimes most vulnerable individuals in our communities.
Yeah, another way that I've seen communities and organizations really work to collaborate and hear from elders is there have been a few examples of like elder councils that have been established. And these elder councils don't necessarily just focus on elder abuse and or domestic violence, but they are a resource that can be established to help oversee, some of the experiences that older people may be experiencing within their communities, and just having a space for them to go to have their concerns or their questions heard, and just thinking about how um, this can be an area to really collaborate with or to help facilitate, create, to ensure that, like, here is another resource. And, hopefully that is something that can be created within, maybe not just within as a little, as not a little, as a council, but can be part of within um, systems of domestic violence itself too. Greg, do you have anything to add?
Like just a slight tangent,
Okay.
which is like I just wanted to make the point that um, older adults is actually kind of a hard term to define. Like at my employer, we say anyone 55 and over, but sometimes you hear 60 and over, sometimes you're 65 and over. So like, I just think it's important. I'm having a bad day here with the Wi-Fi. No, but because like someone who's 55 and someone who's 95, like those are actually very different stages of life, but they could both be called older adults, right? And Victoria was making the point earlier about like sometimes the person who's 95 is running a marathon. Sometimes the person who's 55 is in a nursing home, right? I'm just saying like we have to be careful about any assumptions that we bring in to work with older adults, because it's a really broad category that includes a lot of different kinds of people and even different stages of life.
Yeah, thank you for yeah, really opening that up and clearing up those assumptions, because I think that is very true. It is very broad. Um, but yeah, so we have about 10 minutes left in our session today, and I would like to open it up to the participants who are here with us to see if they have any questions for any of the panelists. I do see a question in here that asks if we are planning on doing a training on this subject. And I'm assuming that's when I mentioned the Elder Council. And as of right now, we do not have any plans to do a training about that subject. So please feel free to type your questions into the chat, and I'll be sure to read them off to our panelists here. Okay, well, if there aren't any questions, I just want to say thank you so much, Gregory, Victoria, and Amanda. It was so great to have you here within today's session. It was so great to hear all of your perspectives and bringing forth some of the experiences you've had working within this specific field. This was a wonderful session, and I want to say many thanks to our interpreters and the NCDVTMH team. And thank you to everyone that joined us. So please click on the survey link that is provided in the chat and let us know what worked and how we did today. And within the next week or so, we will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and any handouts that may have been mentioned, all of which will be available on our website. So you will also receive certificates of attendance for your time today and a link to the evaluation for the webinar. And so thanks again, and we hope you all have a lovely afternoon.
Thank you so much.
All right, thank you.
Conversation.
I don't know if there was one question that came
I
up in
do
the
see
chat.
one question. Yes. It was mentioned to have elders buy-in. What about if their mental state isn't good? Does anyone on the panel want to answer that question?
I mean, I could say something. I mean, if someone's in a serious, mental health challenge, then I think that's when we should view ourselves as mandated reporters. If someone's not able to participate or not able to understand what's happening, I think that's when we do have to kind of step in sometimes and make a report on a person's behalf.
Yes, I mean, I agree as well. And again, that I think that comes in partnership, importance of a partnership of working with a mental health agency or even physician as service providers, to know if you have concerns about that, to partner with those who that's their expertise. Well,
Yeah, I would also echo that, those sentiments, and say that's absolutely the time to look at, well, who else in the community, who else are the supports for this person, and how to bring in people who are experts while we can offer what support seems appropriate and helpful to that person in the very moment they're in front of us. Because I think there's also sometimes in general in advocacy, it can seem overwhelming if someone is having a mental health crisis with us. So if that's the case, remembering that it's so powerful just to do what you do and to think about, like, how am I grounded? How can we co-regulate? How can we, de-escalate together? Because potentially it is not a long-term state. It's potentially passing. Of course, if this is related to, a physical condition, then that's a different case. But, still thinking about what kind of support can I offer right now as we make those connections and look at who else could be a support.
Thank you. Again, thank you all for who have attended, and thank you so much to our panelists, our interpreters, to NCDVTMH. If you do have any more follow-up questions, please feel free to email myself, or you can email our info email, which is info@ncdvtmh.org. I can put it in the chat right now. dvtmh.org. And we will be sure to answer any of your questions if you have any. So thank you all so much, and please have a wonderful rest of your day.